Now senior scholar at Johns Hopkins and infectious disease expert, Dr. Amesh Adalja. Doc, pleasure to have you on. We've been speaking to you the last couple days here. So where are we at in terms of the United States? And should anyone here be worried? I know they're monitoring the people that's already got off and went back to their home. I know there's 17 Americans on board that ship here. Talk about it.
No, I don't think that the general public needs to worry. Remember, this is a virus that has very difficult time transmitting between persons. It requires close contact over a prolonged period of time. You just heard the WHO spokesperson say even people who shared the same cabin on the ship didn't transmit. So this doesn't change anything. We're not seeing anything dangerous right now. This is a public health emergency, and we want to do it right and control it and get to the end of it as quickly as possible. But no, there's no reason to panic in the general public. Public health is working the way it should be.
So, Dr. Adalja, it really sounds like what is happening now is, of course, all of the passengers who were on that ship are simply being monitored and quarantined just to make sure that they do not have any signs of the virus, again, before being, I would say, reintegrated into their community. So, again, this is out of extreme caution versus panic.
Right. People are kind of going above and beyond with some of these quarantine logistics that are going on, because remember, with hantavirus, you're not going to be contagious until you have symptoms. So it's important to monitor those individuals, and there's various ways you can do it. Some of them are going to Nebraska. I don't know how long they may stay there in that biocontainment unit, if they're just being processed there or they're going to remain there for the 6 weeks. Some people are at home where they're being monitored by health department officials to check in, to measure their temperature, and then if they develop symptoms, to get rapidly linked to care and tested. So there's a little bit of flexibility in how you do this type of monitoring and quarantine. But the key thing is we are kind of meeting these cases or meeting these individuals as they come, which is what you want to do. You want to be proactive so you're not surprised and you don't foster any kind of panic.
So, Doc, you just said it's not contagious until you start showing symptoms. So in theory, if the people in the United States, they don't start showing symptoms, we have nothing to worry about. What's the window for that? What's the timetable for when possibly they could?
This particular hantavirus has a pretty long incubation period. So the time from exposure to symptoms, that's the incubation period. It can last up to 6 weeks. So we will be watching those individuals for that period of time. Most people are going to probably get ill within 2 weeks, but kind of to be on the very cautious spectrum of this, 6 weeks is how long you'd have to watch.
All right, Dr. Amesh Adalja, we appreciate your insight and, again, explaining everything to us and also to our viewers. We appreciate it.
Thanks.